Hello and welcome back to House Call. Did you know that back pain is the second most common reason that people go to the doctor in the United States and the leading cause of disability in Americans under the age of 45? So a question that some doctors bring up is laser spine surgery. Question for us is it a good option? Dr. Siegel, what do you think?
I think that surgery is the last thing you think of when it comes to back pain. I'm not saying that you don't do it, but I'm saying it's not what you do first.
Right.
The first thing you do for do-it-at-homers is this back pain, is there tingling going down your legs? Is there numbness going down your legs? Are you weak going down your legs? Or is this all localized? If you don't feel weak and you don't feel tingling and you don't feel numbness and you don't have a foot drop, the chances are, and it's acute and it's just happened, the chances are you may be able to treat it yourself with heat, with exercise, and with getting up, by the way. We're way too sedentary. If you go to the doctor, then I say, because my wife preps me and she's a neurophysiologist that's an expert at back pain, I say don't go to a specialist on this, and they can determine if you had any of the neurological symptoms that I talked about, tingling down the leg, numbness, they can determine what the cause is. Is it a disc? Is it a narrowing in the canal, lumbar stenosis? Many, many things can cause it, but first question is it neurologic or not?
Well, you get an MRI. I got the tingling, and I get numbness in one of my legs. I'm going in PT right now. So I haven't even thought of spine surgery because PT can usually straighten me out,
right,
if I can get straightened out.
Well, I think physical therapy plays a big role, and I think that's perfectly okay. But, Eric, it depends on what kind of problem you have in your spine. If you have, for example, spinal stenosis, or you have discs that are pressing against your nerves, you're not going to always do well with physical therapy. You may need an orthopedic surgeon or a spine surgeon to really fix it. They do surgeries. They fuse some of the vertebrae to make it stable. A lot of times when we talk about these laser or minimum invasive surgeries, you can go in without having a big scar. You basically tunnel through, you find the bulge or the disc that's pressing against the nerve, and you can take care of the problem and the issue.
What does the laser do?
The laser is really, sometimes in 30% of the time, it's used to take some of the bone away from the nerves, because it's very delicate and it's less invasive, but it's not always being used. It's the judgment of the surgeon. Going back to back pain, 8 out of 10 Americans suffer from this, and I think when you're younger, or under the age of 45, a lot of it is because of our sedentary life, sitting behind computers. We're always sitting, hunching over, and that's what it is. As you get older, that's when arthritis and other causes of back pain can get in, and you have to talk to your doctors, find out if there's a genetic component. We just talked about overweight. Overweight is one of the big reasons why people have back pain. So just simple exercises and weight loss, and epidural and these injections are not always the answer. There are cases where they can help, but talk to your expert specialist.
So Mark, what's your best advice right now to prevent serious back pain as you get older?
Well, the first thing you got to do is exercise. Get up regularly, exercise. Don't sit in that chair. Even when you're not exercising, get up. That's number one. Losing weight, as David said, that's a biggie. If it's a muscle spasm, you might be able to treat it temporarily with heat, non-steroidals like Advil, stuff, Aleve. But if you go to the doctor and they find that you have some kind of problem like this disease or narrowing, and physical therapy isn't working, try the conservative things, and then if you have to have surgery, choose a person who's the best at what they do. Like we always say with Dr. Samadi, he's the best at what he does. I want a back surgeon that, don't go to a laser surgeon that does 10 of them. Go to a surgeon that does it the most and has the most experience.
And you can ask. We did that once. You say, how many do you do? They did one a week.
The best thing if you have back pain is to rest. You don't want to go back to doing the same exact thing. If it doesn't go away, and if there are symptoms, for example, urinary symptoms or bowel issues, etc.,
that's an emergency.
make sure you see somebody and get an MRI and you can fix it.